right now.
Severe tooth pain and dental emergencies don't stop just because of a pandemic. However, we've been seeing in the news lots of people aren't going to the doctor for a lot of serious issues. To tell us more about tooth pain and when it is time to visit a professional, we're joined by Dr. Alan Gluskin.
Well, it's hard to run away from a dental toothache, especially one that causes swelling in your jaw and maybe waking you up out of a sound sleep at night, or you're enjoying a nice cold drink and it triggers a toothache that lasts for 10 or 15 minutes. That is very hard to ignore, especially when it's persistent, and most toothaches are, and they can manifest into deeper infections within your jaw. So all dental complaints that are like that, you should really see your dentist. And there are specialists called endodontists who get 2 or 3 years of training after dental school to manage your toothache in a painless way. They're experts in pain control. They have high technology. Most endodontists 100% use microscopes to see down inside the tooth and can magnify it 10 to 20 times. Most endodontists use three-dimensional x-rays which surround your head, and so those films that they put deep in your mouth don't have to be done a whole lot for endodontic work by a specialist. So if you want painless treatment and you want someone who has the education and knowledge to treat your problem and solve your problem and save your natural tooth, hopefully for a lifetime, you want to go to an endodontist. Good oral health means pretty much good general health if you're taking care of your mouth. And so waiting on a tooth infection, but also having the wherewithal to want to save your natural tooth. I mean, your tooth and your smile brings you beauty. It brings you better health in your older age when you need to eat nutritionally really well and you have those back teeth to eat with. So saving your natural tooth and going to someone who doesn't, there's very little risk that they'll have to do it over. And oftentimes dentists try to do some root canals that they just don't have the skill to do. And so you do want an expert.
And of course, people are concerned right now with COVID-19. What precautions are taken in the office to prevent this?
Emily, any patient that goes into a dental office should see several things that are different. They should see the staff continually wiping down the office. They should see staff with gloves or washing their hands continually. They should see all staff wearing masks. And to socially distance from other patients that might come to that office, they should definitely have staff call them in their car while they're waiting on their cell phone. So they should see the social distancing when you're waiting for your next appointment. So patients should see, especially in specialist offices and in all dental offices now in the time of COVID, the dentists are making those important changes to protect their patients.
And there's something called a rubber dam. What is that?
A rubber dam is a device that is 100 years old, and quickly I'll explain it. It's very thin. 100% of endodontists use rubber dams for their care and treatment of patients who are having root canals. It is placed over the tooth to protect the patient's airway from getting the breath of the dentist and his staff near them, and it protects the dentist and their staff from the aerosol and the breath of the patient. So we can isolate teeth and work on them and do our root canals much more distance than we ever have in the past. The dentist does not have his head in the patient's mouth anymore, and the endodontist especially is protecting that patient from both staff and from the patient themselves.
So where can folks go for more information?
I would hope that they would seek out an endodontist on their own. They have every right, or their dentist can refer them. But the website Find My Endodontist, ENDODONTIST, findmyendodontist.com. You'll get a search engine. You put your zip code in, and there will be several specialists that will be available for your treatment if needed.
Broken AC, $4,600.